Hello everyone, in this video we are going to study about Naja tripudians. The common name of Naja is Cobra virus. You can look at the picture here. The Naja snake, the Cobra virus, the Cobra snake. It is proved by Russell and Stokes. It belongs to the Elapidae family. This is the introduction of Naja. The common name is Cobra virus and it was proved by Russell and Stokes it belongs to Elapidae family. The sphere of action of Naja tripudians. Naja has a strong affinity for heart. All its complaints have the tendency to settle around the heart. So predominantly where does Naja act? It acts upon the heart. Other than heart, it also affects the nervous system such as medulla oblongata, cerebellum, respiratory nerves, pneumogastric and glossopharyngeal nerves. So apart from the heart, it affects nervous system. In the nervous system, medulla oblongata, cerebellum. Then you come down respiratory nerves. The respiratory nerves, two nerves, pneumogastric nerve and glossopharyngeal nerve. Now let us see the guiding symptoms of Naja. All the complaints have the tendency to settle around the heart. As we read, predominantly it acts upon the heart. All complaints will land up in heart. Left side is principally affected and have the symptoms and have the tendency to go from left to right. So guys, here all the symptoms will first begin in the left side, then go to the right. Like you know, in all the Ophidia groups, it is predominantly on the left side. All the symptoms will start from the left and then have the tendency to go to the right. All the complaints will aggravate after sleep. Sleep profound like a log with stertorous breathing. So guys, how is the sleep in Naja? The person sleeps like a log. Log means a wooden planks. He sleeps like a wood piece, just stiff, all straight. And then stertorous breathing. He makes noises like noisy breathing during the sleep. Hope first three points are clear. All the symptoms will settle around the heart. Then it is left-sided. Affects left side and symptoms will move to the right. And the symptoms, when are they aggravating? After the sleep, and the person sleeps like a log with the stertorous breathing, with a noisy breathing. Profound exhaustion and trembling of muscles. The person gets fatigue easily. He is tired so fast. He gets tired fast. Profound exhaustion, and along with that there will be trembling of muscles. There will be shaking of the muscles. Constriction of the throat and the chest. Sensation of hot iron running through the system. The person feels that a hot iron is just running all over his body. Copious sweating of the hands and the feet with a sensation of puffing and fullness. As you can see in the picture given here, there is copious sweating. You can see the hands, how badly they are sweating here. Copious sweating of hands. The same goes with the feet, with the sensation of puffing and fullness. Very susceptible to cold. Body cold and collapse. You can see the person, she is very susceptible to cold. She goes out, she catch cold easily. Inability to speak, choking, nervous, chronic palpitation, especially after public speaking. Guys, you can see here the person is unable to speak. Public speaking, he gives some lecture or something, he becomes all nervous. Palpitations will begin in him. Hope it is clear. First thing, there will be trembling of muscles. The person gets tired, and then there will be constriction of the throat and the chest, and the person feels as if hot iron is running on his body. The hands and the feet will sweat a lot, and there will be puffing and fullness, and the body catches cold easily. He is unable to speak, and after public speaking, he is nervous and there are palpitations. Now let us move on to the mentals of Naja. Broods constantly over imaginary troubles. Suicidal insanity. Same goes with Aramet. So guys, here the person thinks that imaginary troubles, like I am going to end up in a bad state, something wrong is going to happen with me. He constantly broods over the imaginary troubles, and the person wants to commit suicide. There is suicidal insanity. He's depressed, aversion to talking, doesn't like talking to anybody, blurred speech, melancholy that is full of sadness, dreads to be left alone, fear of rain. The person fears of rain, very peculiar. Naja, fear of rain. Very forgetful, absent minded. He forgets things very fast. He keeps things somewhere, then he forgets. You ask him what happened short term, nothing he'll remember. Because he's absent minded, which leads to forgetfulness. Very forgetful, absent minded, insensible, loss of consciousness, insanity. There is madness. He suddenly splits his own head in two with an axe. Guys, you can see in the picture here, the person is having an axe. Now he's going to split his own head into two pieces. This is what the Naja does. This is how the suicidal insanity is in that person. And then sadness is aggravated in the evening. So the mentals, what all are you going to remember? First thing, he broods over the imaginary troubles. There is suicidal insanity. The person wants to split his own head into two pieces with an axe. He doesn't like talking to anybody. There is sadness. He fears of being alone. He's having a fear of rain. And one more symptom was like he's very forgetful and absent minded. Hope the mentals are clear for you guys. Now we'll move on to the particulars. Like I have the sequence is like from the most important I have started. Like predominantly all the symptoms will land up into the heart. So first we'll be dealing about the heart of the Naja. For restoring the heart damaged by acute inflammation or relief of sufferings of chronic hypertrophy and valvular lesions. So guys, whenever there is acute inflammation of the heart and it damages the heart, for restoring the heart damage which is caused by some acute inflammation, we can think of Naja. And then also to relieve the patient from the sufferings of chronic hypertrophy of the heart. Hypertrophy is increase in the size of the heart, and valvular lesions, the valves, there will be defect in the valves. So to restore from the hypertrophy of the heart and valvular lesions which are chronic from years long, is suffering from the hypertrophy of heart and from the valvular lesions, to bring in the relief from such suffering, and also to bring relief to the damage of the heart caused by acute inflammation. Next, simple hypertrophy of the heart. There is simple increase in the size of the heart because of some pathological condition. Excited tremendous action of the heart. Palpitations of heart from exertion, talking or walking. So whenever the person is putting some effort, he's doing some exertion, he's talking, he's walking, all these will lead to palpitations of the heart. Then you have to think of Naja. Severe stitching pain in the region of the heart, and the stitching pain is extending to the nape of the neck, left shoulder and arms. So guys, usually people say with the left chest complaints, heart complaints, they say the left arm and the left shoulder is paining. Like this, you can remember the Naja, the pain, stitching pain will start in the heart. Heart lies slightly to the left, so the left shoulder and the left arms will be hurting. There will be stitching pain. So heart guys, to restore from acute inflammation of damage by acute inflammation and chronic hypertrophy and valvular lesion. Then if the heart is all excited and there are palpitations of the heart, the palpitations from exertion, walking, talking, and along with that there will be stitching pain. The stitching pain, where does it extend? Nape of neck, left shoulder, left arm. Hope it is clear. Next, heart. The pulse will be irregular in force but regular in rhythm. The pulse, you check, the rhythm will be normal but the force of the pulse will be irregular. Sensation of oppression in the chest and heavy weight on it. You can see the person, there is oppression of the chest and he feels as if some heavy weight is on him. Marked symptoms of low tension, threatened paralysis of heart, post-diphtheritic. Irritating, dry, spasmodic cough in the acute stage of rheumatic carditis or chronic organic lesions. So guys, what is the person having? How is the cough in the person? It is irritating, it is dry and sympathetic cough. When does this cough occur? In the rheumatic carditis, in the acute stage of rheumatic carditis. Person has rheumatic issues, rheumatic fever and everything, which end up in the heart complaints. Rheumatic carditis, in the acute stage of rheumatic carditis, the person is having irritating, dry and sympathetic cough. And also the irritating, dry, sympathetic cough is also found in chronic organic lesions. The pains are aggravated by carriage riding in open air. You can see the carriage riding. Whenever the person takes the carriage ride, the symptoms are going to aggravate. So guys, how is the pulse? It is rhythm will be regular, RR, rhythm regular, force irregular. Then there is operation in chest and heavy weight on it. Low tension will be there. Paralysis of the heart after the diphtheritic condition. Once the person suffers from diphtheria, then post-diphtheritic, he will end up with the paralysis of the heart. Then we read about the irritating, dry, sympathetic cough very clearly. When all is it found? In rheumatic carditis and chronic organic lesions. So finally, the heart complaints are aggravated by carriage riding and in open air. Now we'll move on to the respiratory symptom of Naja. The nose, severe coryza, thin, acrid secretion. Severe coryza, like we read, the person is having he's very susceptible to cold in the mentals. So again, the guiding symptoms actually, so the person will be suffering from severe coryza, thin acrid secretion. The secretions are acrid, they are excoriating. Nose is sore, hot and swollen with a thin discharge. You can see in the picture here, hot and swollen nose, it is sore with a thin discharge. Stuffing of nose is beginning in the morning and it is increasing later. It is aggravated in open air by discharge of thin watery mucus. How is it ameliorated? By discharge of thin watery mucus. The discharges are going to reduce the complaint, whereas when the person goes in open air, the symptoms are going to aggravate. So guys, how you need to remember is, a person, Naja, he catches cold easily, he'll have coryza. He wakes up in the morning, the coryza is the cold coryza is going to increase. Later on it's going to increase. He moves out, he goes into the open air, like a person, like a girl is having a girl is a Naja patient, and then she wakes up, she's going to college in the morning, the coryza increases. Then in open air she's going, increases. But as the discharges of the thin watery mucus, then it reduces. As the discharges pass by, the coryza is going to reduce. Soreness with irritation, soreness of right nostril. Guys, you can see here, soreness with irritation. The person is having irritation, soreness of the right nostril with ulcerated feeling. So everything is left in Ophidia groups, but here in the coryza, the right nostril will be sore with ulcerated feeling. Wing of the nose becomes sore with heat and tenderness. Worst next day with swelling and pain. So guys, first the nose will become sore. There will be tenderness and it will become hot. There will be heat and tenderness. What happens the next day? There will be swelling and pain. So hope the respiratory system is clear. How do you remember? Person is having coryza, the secretion is thin and acrid, morning it's going to increase, and how is it ameliorated? By thin discharge. As the discharges happen, the complaint is going to reduce. And then along with the soreness, redness, there will be irritation in the right nostril, and there's tenderness. The tenderness and the heat, the next day it is going to become swollen and painful. Now it is nose complaints. We are very clear with the nose. Now we are going to see what happens in the throat of Naja. see what the person is going to have in the throat. There will be much mucus in the throat, pressure and gagging in the throat. So guys, the mucus content is very much profuse in Naja. Roughness and scraping in the throat, grasping at throat with the sense of choking. The person will have as if he is going to be choked. You can see in the picture there is grasping at the throat with a sense of choking. Dryness and constriction of the throat and fauces. Stricture of the esophagus. Because of the stricture of esophagus, the deglutition difficult. That is, the swallowing will become really difficult because stricture, there is narrowing. The esophagus becomes narrowed there. So the person cannot swallow. The swallowing, deglutition becomes difficult or impossible. Dark red color of the fauces. So guys, in the throat, mucus content will be more. There will be gagging, scraping, roughness, and there will be a sense of choking. Along with that, constriction in the throat and fauces, dark red color fauces. The constriction, along with the constriction, there is stricture of the esophagus. Since there is stricture, the person cannot swallow. Deglutition is impossible and difficult. Hope throat is clear. Redness of left side in the morning with a pain on swallowing. Guys, you can see here, there is redness of the left side of the throat in the morning with a pain on swallowing. Inflammation of the left tonsil at 8 a.m. You can see the tonsil here, it is all inflamed. The left tonsil is going to be inflamed, especially in the morning, 8 a.m. Spasms starting about his throat, external. So there will be spasms along with that. Naja, all left-sided, only the nostril right-sided will be ulcerated. You can see the left tonsil is inflamed and the left side of the throat there is redness and there is pain in swallowing. Asthmatic constriction in evening, asthma beginning with coryza. So guys, morning the girl had coryza, evening she comes, the asthma starts, asthmatic constriction starts in the evening. You can assume that she is the Naja patient. She had the nose, there is coryza and everything, it is aggravated in the morning. Then in the evening, asthmatic constriction start. You can see here the constriction, the mucous airway, which leads to asthmatic constriction in the evening. Okay. Now let us see the female complaints of Naja. Neuralgia of left ovary, often serviceable in obscure pain in left groin, especially in post-operative cases, seems to be drawn to the heart. So guys, neuralgia of the left ovary will be there. You can, like neuralgia happens because of the nerve damage. And then it usually in the post-operative cases, a person has some cyst or fibroid or whatever in the ovaries, all those complaints after getting operated, the neuralgia starts. And after the neuralgia, once whatever the complaint is, finally it's going to land up in the heart. It seems to be drawn to the heart. Neuralgia of left ovary, it seems to be drawn to the heart is what you need to remember. Sleep profound like a log. We read in the guiding symptoms. You can see in the picture here how is the Lachesis patient sleeping like a log with stertorous breathing, noisy breathing, and a typical reptilian state. Ears, illusions of hearing. The person feels that somebody is calling him, or he has illusions of sounds, of noises as though somebody is speaking. Illusions of hearing. Otalgia, chronic otorrhea. You can see the discharges here from chronic, years long. Black discharge, the discharge, earwax, the discharge is black. It smells like herring urine. It smells like urine. It is like very offensive. Here there is black discharges which smell like urine, chronic otorrhea, otalgia, and also the person has illusion of hearing. Now let us see the head of Naja. Head, pain in the left temple and in the left orbital region. So near the eyes, guys, here the temple, the sides, the temples, and near orbital area, there is pain in the left orbital region. It is extending to the occiput. So from the temple and the orbital, it is going back and settling in the occiput with nausea and vomiting. Hay fever, the picture of this girl, the blue eyes girl, this is a picture of the hay fever, typical hay fever look, with dry larynx, suffocative spells after sleeping, lachesis, eyes staring, ptosis of both lids. Ptosis is the drooping. You can see both the eyelids are drooped here. There is ptosis of both the lids in Naja. How is the head? The pain will start in left temple orbital, then it settles in the occiput. Then there is nausea and vomiting. It is extending to occiput. There will be nausea, vomiting, hay fever, then the ptosis of lids, that is drooping of lids. Last but not the least, we come to the modalities of Naja. When are all the complaints worst? The complaints are going to be worst from the use of stimulants. When will it be better? From walking or riding in open air. So guys, we saw here in the carriage, where is it? Pains are aggravated riding in open air. So the heart complaints are aggravated by riding in the open air, but in the modalities they have given, it is better from walking or riding in open air. So this is what you need to remember. With this, we come to an end of Naja. Hope everything is clear. If you like my video, hit the like button and subscribe to my channel. If you want me to make more videos on the medicines, you can put it in the comment box, whichever the medicine you would like to be explained.